Accident is an unplanned occurrence of an event which may involve injury and resulting in recognizable damage. It occurs in a sequence of events which usually produce unintended injury, death, or property damage. Accidents are endemic all over the world. Major cause of deaths in the age group of 10 to 24 years. There are many types of accidents, which include road traffic accidents, domestic accidents, industrial accidents, and railway accidents. Accidents are complex phenomena with multiple causation. Large number of old, poorly maintained and poor road standards has been a major contribution for the accidents. Multi-sectorial approach, data collection, reporting system, and special survey of accidents is required for the better outcome of prevention of accidents. Accidents are considered to be purely physical but can have a deep psychological effect on human mind as well. In fact, the vehicular accident cites that 9% of all accident victims go to develop post-traumatic stress disorder, a severe mental health condition that can interfere with daily routine life. Their physical body may receive little to no injury, yet your emotional state can be shattered. Being involved in an accident can cause physical, emotional, and financial difficulties. Some physical damage can be seen straight away, like cuts and bruises, whereas other types of severe damages may not be noticeable until after that, such as back and spine injuries, loss of limbs, and sometimes it may lead to death miserably. For more than 10 years, the number of incidents involving car crash and other vehicular accidents have increased dramatically. In the year 2015, the most number of road accidents were recorded, having 10,000 totalities of death. Mostly pedestrians aging from 15 up to 29 years old are the most vulnerable from vehicular accidents, resulting in the increased percentage of 45.76 compared to the recorded number of deaths for the year 2006 of 6,869. Starting from the year 2010, the reported deaths as in ramification of car crash incidents is not lower than 8,000. Yes, that is in the Philippines alone. Road safety is an issue of international concern. Many accidents can be prevented, and in those that are not preventable, the damage could be lessened, such as using the helmets as safety gear to prevent injuries in an uncontrolled environment. A helmet can thus prevent injury to the head and the brain. Helmets should be sturdy and cover the head as well as the neck. Avoid distractions. The individual should always give utmost attention while driving. The person should completely avoid using their cell phones. The driver must watch pedestrians, provide an exclusive space for the pedestrians to walk outside of the travel area. Always buckle up before driving or riding in a car. A seatbelt that works properly will keep you at a safe distance from the dashboard and the airbag. Do not drink and drive, because it is an indiscriminate crime, men and women, whether they get into an accident or not. Every drunk driver has the ability to cause severe damage and fatality. Defensive driving ensures that everyone on the road has a safe journey, so maintain a reasonable distance between your car and the vehicle in front. Do not exceed the speed limit, because safe speed is necessary to control your vehicle and stop in time to avoid a collision.
Now coming to falls. Falls is an event which results in a person coming to rest on the ground or another lower level with or without loss of consciousness or injury. Some of the most common causes of slip and falls are wet and uneven surfaces, adverse weather conditions, improper training in the workplace, nursing home neglect, and footwear. According to Global Floor Safety Network, slip falls are trip, slip, and fall incidents are the number one cause of accidents in hotels, restaurants, and public buildings. Its leading cause of death in the workplace and its source of more than 57% of all disabling injuries is the workplace. The most common types of slips and fall injuries are soft tissue injuries, head injuries, cuts and abrasions, spinal cord injuries, and broken bones. According to the Centers for Disease Control and Prevention, 1 out of 5 falls causes serious injury such as broken bones or head injury. Over 800,000 patients a year are hospitalized because of a fall injury, and falls are the most common cause of traumatic brain injuries. According to the Centers for Disease Control and Prevention, 35% of all traumatic brain injuries are attributed to falls, particularly when falling backward. Falls contribute to about 25% of spinal cord injuries. Fall accidents are fifth leading cause of Filipino kid deaths. Safe Kids Philippines said falls count as the fifth leading cause of unintentional deaths of children below 14 years old in the Philippines. Citing the Safe Kids Worldwide 2013 survey, Safe Kids Philippines said that the leading cause of mortality of Filipino children is drowning, followed by road accidents. Safe Kids Philippines added that 54% of children who died from accidental falls were aged 15 to 19 and 78% of them were boys. So the next one is preventive measures of slips, trips and falls. Actually, in these the most accidents were easily preventable, but we should follow the safety measures. So I'm gonna say a few of preventive measures of these slips, trips and falls. So practice good housekeeping. This can help to prevent falls, and clean up all spills and debris immediately. Mark or identify spills and wet areas, keeping walkways clear or clutter and other obstacles, and closing file cabinets and storage doors immediately, and covering or taping down cords or cables, and selecting and wearing proper footwear is must, and match your footwear to all the hazards of your job, and keep shoes in good repair, clean and free from contaminants. And to prevent falls, use appropriate non-slip flooring material and provide adequate lighting. So these simple steps can prevent you from slipping, tripping or falling. So that's it. Thanks for listening. Thank you.